In the next segment tonight, the nation's most powerful lobbying group for senior citizens, the AARP, is perceived to be firmly behind President Obama's health care vision. That's causing some controversy. In Dallas, for example, some AARP officials were confronted.
I think we can all agree that the system that we have now isn't sustainable. And I also think that we can agree that the current system could use some reforms and improvements. Just to review the program. Excuse me, but I would really appreciate it if everybody could keep their comments quiet until there's time for the public. We're going to have time for everybody to have question and answers, and I would appreciate some courtesy. You know what? You're not really running the meeting, sir, so I'm going to go ahead and continue. We're working on. Excuse me.
Do you guys work for us, or do we work for you?
AARP has not endorsed the legislation. You're incorrect. Anyway, I'm done.
Well, that did not go well. With us now, AARP Legislative Policy Director David Sertner. So, it may not be fair, but it's perceived that you guys have allied with the Democratic Party, Barack Obama, on the health care issue.
Well, we have been very strongly in favor of health care reform, running up the last 2 years right into the election. Now, we have not, as was just said, we have not endorsed any specific piece of legislation right now, but we really are intent on trying to fix the health care system and the pieces that concern our members.
But so am I. I mean, I want to fix the health care system, and I believe it needs to be fixed. But, you know, Nancy Pelosi writes a memo that they're going to partner up with AARP as part of a planned August recess PR blitz. I don't know if you want to be on the same side as Nancy Pelosi and still say that you represent American seniors. She's a pretty extreme politician.
Well, I'm not sure what that memo was, but we're not partnering with any of the members.
Well, why would Ms. Pelosi say that?
Well, we're working with the Democrats and Republicans and have been for a couple of years. In fact,
well, why would she say that? Certainly that's a big deal. If Nancy Pelosi is going to put that in writing, that the AARP is going to partner up with her Democratic Party, that's a big deal, is it not?
Well, we're not partnering with her.
Did you make that clear to her?
I think we've been working with members on both sides of the aisle, including the Democratic.
When she wrote the memo, how did you respond? Did you call her and say, don't do that? It's hurting our organization?
I don't believe that memo ever came out.
Yeah, it did.
Not that we've seen on
last week, Human Events reported on a memo from Nancy Pelosi where she described the Democrats' plan to partner with AARP as part of a planned August recess PR blitz.
As I understand it, that was a draft memo, and when the final memo came out, AARP was not included in that memo.
Did you call her and tell her not to include you?
Well, we've been working with both sides, Bill. I think we should leave it there.
Now, your CEO, Barry Rand, gave $9,000 to Barack Obama. Now, that's a big number.
Quite frankly, people at AARP give to both sides of the aisle.
Okay, but if Barry Rand's going to give him $9K and Pelosi's going to make that memo, you can see why the people in Dallas are a little skeptical of the AARP.
Well, quite frankly, Bill, our policy decisions are set by our board of directors, an all-volunteer board made up of both Democrats and Republicans, and we've been very careful over the years to be centrist. We've been attacked from the left. We've been attacked from the right over the years. We try to represent our membership. We don't try to represent any of the parties.
There are two big issues for the AARP, and that's rationing of care. You understand that in Canada, and the government runs the health care system, medical care is rationed.
Right, and
you got that.
And we would reject that kind of care here in the U.S.
You wouldn't have any choice if the government takes over the system, and there just simply is not enough medical personnel to handle the elderly.
Right, and we would not support a system where there was a government takeover or there was any kind of rationing.
So you want to keep the medical health care system in private hands?
We think that there should be choices of public and private options for people. We have no problem today with people making sure that
you want competition between public and private?
I think that makes a lot of sense.
But if the competition is skewed because public money helps the government run, how the private insurance companies are going to bail. You know that. They're going to bail out.
I think that's part of the debate right now in Washington over how to set up the system so that there actually is competition. Right now, for example, in the Medicare program, people have a choice between the traditional Medicare plan or some of the private companies within Medicare. We support that. We think it's a good idea to have competition.
I think it could be worked out, but not in the present form. I don't think anybody understands what this bill is going to do. Have you read the whole bill, more than 1,000 pages?
I have read the bill, and in fact, we have a whole team of people who've read through the bill.
Do you understand what it's going to do?
It is complicated, and that's why we've been doing these town halls around the country, because we're trying to have some give and take with people.
Would you vote for this if you were a congressman, Mr. Sertner, right now? Would you vote on it? Would you say, I want this bill? As confused and as chaotic as it is, would you say yes?
Well, it's an unfair question because, as you know, we have...
You read it?
Well, we have 4 different bills right now.
No, but I want you.
4 different committees pending in the
one
House.
that you read, the 1,000-pager.
Well, there is no final bill yet, Bill. There are a number of pieces, and there's a lot of pieces in these bills we like, and quite frankly, there are some we're not particularly fond of.
Now, I'm worried about the overall efficiency of government. As you know, the fraud in Medicare and Medicaid is colossal. Why would you want the federal government to come in and run a national health care when California's bankrupt? They say Massachusetts is doing well. We look at the numbers, it isn't. Okay, why would you want it?
Well, let's talk about a government-run plan, because that's what Medicare is, as you know. And it's, by and large, our membership likes Medicare. There is not a perfect program. There are problems with it. We're trying to improve drug coverage in it. We think there's more fraud and waste than there should be. In fact, some of the bills pending right now would help weed out some of the fraud and abuse, which we think is a good thing.
And you have confidence the government can do that?
Well, we think government needs to do a better job than it's doing today, quite frankly. There's a lot of wasted money that everyone knows we need to get out of the system to hold down costs.
Mr. Serta, we appreciate you coming in and explaining.
And I really appreciate you giving me the opportunity.
And we want to be fair to everybody in the debate. Thanks for coming.